It's recording. Okay, great. Hi, everyone. I am Christine Mattis. I am the owner and founder of the Mattis Law Group, where we focus on helping our families, especially those with special needs, children, adult children. And it is my pleasure today to have Cara Graham here. It's been a deal for me dealing with everyone knows that I have two beautiful children and my youngest born with Down syndrome, and she does have some behavioral issues. And because we've been homeschooling, I've realized that I am not the professional, and learning how to help her has been such a challenge. And so I had the pleasure of connecting with Cara Graham, and she is the owner and executive director of Graham Behavioral Services. And I was hoping she could share some insight about what we can do as parents to help our children while we're at home. And Cara, thank you so much for being here. I really appreciate it.
Absolutely. I'm super excited to be here. Happy to help in any way that I can. I know this is kind of a crazy time for everybody. So, I know everybody's just trying to, as we said, figure out the new normal. But, hopefully today I can give you some resources or guidance or just some information to kind of look into that may be helpful to, help structure everybody's day a little bit and make things a little bit easier.
Cara, would you be able to share with everyone your background, your expertise, like how long you've been doing this and how long has Graham Behavioral Services been around?
Sure, sure. So I've been in the field since 2009. I started in the field. I kind of fell into it. I started working as a paraprofessional in a classroom for children with autism. And that school that I was working in did applied behavior analysis services. And that's the type of therapy that we do. I had never worked with anybody with autism before. It was my first experience, and I just completely fell in love with it. I loved the field, loved working with the kids. And I was like, now I have found this is what I want to do with my life. So from there, I got my master's degree in special education, completed my coursework in behavior analysis. In that time, I've worked as a special education teacher. I've worked as a behavior analyst for public school districts. And in 2013, we started Graham Behavior Services, where we provide home programming services. So it's ABA therapy in the home. So we come to you for individuals with behavior challenges, special needs, developmental delay. Really, we can help anybody. We try to help anybody we can with any behavioral challenges. So we come to you. So we go to families. We work with them in the home. We work in the community. We really work on a variety of skills too. So we can work on things related to self-care, so helping people to become more independent in their self-care routines. We can work on increasing language skills, decreasing problem behavior, helping families with things in the community with their children. So things like dentist appointments, doctor's appointments,
Oh,
haircuts.
wow.
Those are all things that are often very challenging for a lot of the kids we work with. Help families in the home to work on those skills, and then we try to work on that in the community as well. And we work with individuals from early intervention age all the way through adults. So in terms of the span that we work with, it really runs the gamut.
I was wondering about that. I was going to ask you about the age limits, and I love how you mentioned doctor's appointments, dental appointments. Big challenge. One of the highlights that we were able to find a pediatrician, a pediatric dentist who was familiar with special needs and able to help our daughter get a checkup, get a cleaning,
Yeah.
to do it in a certain technique way that we got the job done. So I'm just shouting out Dr. Eliza Velasquez. She's fantastic. She's local here in Toms River. She's been excellent with our children, so we highly recommend them. So I could only imagine some of the calls that you've been getting from clients and patients and families, because right now with this lockdown and the social distancing, what I've seen is where we've realized we're not the professionals in this to help our children. We're doing what we can, but I'm hoping that you could share some insight of what parents might be able to do while they're home with their children. And if there is, I know there's different types of behavioral issues, but perhaps there's something you can share that we can start doing or looking into.
Yeah, absolutely. So, a couple of the things that we always tell our parents, like a couple of like the The main things that I would say is consistency and having a schedule.
Mm.
Those are the two big pieces that you really want to look at. And I'll kind of tackle them one at a time. So in terms of consistency, this is something that we're always driving home to our parents. And when I say consistency, I don't mean always being the bad guy or always, being mean or firm. It's really knowing, like, what are you going to agree to as a parent before you verbally say anything to your child. And
Yeah.
I'm a parent myself. I have a 4-year-old and I have a 6-month-old, and I'm guilty of making this mistake with my own child all the time. But, certain things, like if your child says, Mom, can I have a cookie? And in your head, you're like, no, I don't want you to have a cookie right now. But if they ask 6 times, you're going to say yes.
Right.
Just say yes from the beginning.
Okay.
So that's the biggest thing. You want to be realistic. And it really isn't even about your interaction with your child as much as thinking about for yourself and recognizing your own behaviors that you're doing as a parent. All right, what are the patterns that I typically engage in? Am I going to say no, 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 and then I'm going to say yes? Because what happens is you're teaching your child to basically nag you,
So true.
or in a more challenging situation, engage in a lot of problem behavior, and then you're going to end up giving into that problem behavior.
So
So
true.
try to start thinking about for yourself, what am I doing? What does my behavior look like? And then how can I change that to maybe help my child,
God.
especially in a situation like this? You're stuck at home with your children all day. Really be realistic with yourself. Like, all right, am I just going to give in 30 minutes anyway? Let me just say yes now, as opposed to saying no, getting a bunch of problem behavior, and then giving access to the iPad or giving the snack or something like that.
Yeah.
The same thing goes with giving directions. Like, if you're going to ask your child to do something, be prepared to follow through with that. So sometimes I may want my daughter to clean up toys, or might want her to do something. But if I also know that I have a phone call that I need to do in 3 minutes, I'm not going to be able to follow through with that direction to make sure she does it.
Oh,
So making timing when you deliver that instruction so that you can follow through with it. So that's the biggest thing when I say consistency. It's not like always being mean, but it's kind of recognizing for yourself as a parent, am I going to be able to follow through with this thing I just asked? Or am I going to be able to follow through with the response that I just gave to the question my child asks?
it
Does that make
seems,
sense?
yes. And you know what it is? I think it feels like it's a lot of thinking ahead, really thinking through and not being reactive, because I am
Mm-hmm.
at fault of that. When things are busy and I'm hearing so many things happening at once, and then they ask for something, and my first reaction is, no, wait, or no, we'll do that later. And then I don't follow through, or say, oh, you have to clean up. And then, right, when you don't follow through, you're right. And I think it's all a matter of making sure we understand what we're trying to do, what we want them to do.
Mm-hmm.
But by you bringing it up, it really makes me think. It really makes me think, like, okay, I started thinking about, okay, what have I been doing? What have I not been doing? I love that consistency. Okay, that's a big deal. And by way of routine, I think so I'm again just thinking about my own daughter,
Yeah.
getting that structure, and making sure, because they are so off their routine to begin with. So we're creating a new routine. And I
Right.
know we're into what, this is the second week in. And I'll be
Mm-hmm.
honest with you, I don't think we have a routine. We kind of do. It's a very loose routine. So my
Mm-hmm.
goal is for next week, okay, let's really narrow down certain times of how we're going to do things, because I think that's reassuring for her too. She'll know what to expect, I suppose.
Mm-hmm.
I think that's probably some of the pluses. But what are some of the challenges you've been also seeing from some of your families, Cara?
Sure. I mean, I would say within, since start of March,
Yeah.
I think the biggest challenge that a lot of our families are facing for our clients, our active clients, is knowing what to do in terms of do they continue therapy with us? Because we're still actively providing therapy to a lot of our families.
Wow. Are you going to the
Um,
home? Are you?
we do right now for some
Wow.
of our clients, we
Great.
still are.
Okay.
ABA is considered a medically necessary service. So we are, following that guidelines as healthcare providers to continue to provide that service.
That's great.
We've increased our safety protocols for our staff, our safety protocols for families. And not all of our families are receiving services. But we're trying to provide as much service as we can for whoever can get it in person, or if they can't, if telehealth is authorized, we're trying to do telehealth services. Um, and I just think so many families are really conflicted with, you know, the risk of not getting therapy, the risk of regression, the risk of increase in problem behavior, severe problem behavior, worth, compared with the risk of, you know, contracting any kind of an illness, so
Yeah,
there's so much that needs to be weighed, that I think a lot of our families are really struggling with that. And we're just trying to be open to every option that's possible to support our families. So,
great.
we do have some staff that are still going to homes and helping families with a lot of our more severe clients. We kind of prioritized them to be like, okay, we really want to try and keep working with you. But then for a lot of our families, it looks like we're just doing kind of like this, like a
Yeah.
Zoom meeting, where our BCBAs are coaching parents through how to handle situations,
Hmm.
or coaching parents on how to teach some of those programs that we've been working on
Yeah.
in therapy sessions. So that way we don't see a huge regression when we are able to start services again.
That is a big
Um,
fear, the regression. So I'm a part of several Facebook groups, and I remember a mother remarking, she said, 12 years of ABA therapy down the drain. And that was the feeling of because of things that were just off routine. We're not getting, the help that they typically would get. And that was so sad to read. And that struck at me. That's why I wanted to reach out to you, Megan, everyone, just what can we do? Because it's a huge issue. It's a huge issue. So I like that you're
yeah.
still continuing. I think that's awesome. I think
We're
that's really good.
trying to
Yeah.
keep everybody safe, but also, really support our families, and it's been a challenge. So last week was a little crazy. This week's a little better, but
Okay. Yeah. And because I can imagine too, the challenges of a family that may not have the tech, may not have the technology. We have some of that too.
right, right. And most people at least have a phone.
Okay.
So at least that can be utilized. Most people have a smartphone. So
Okay.
we personally have not run into that issue too much. But there's also the issue of reactivity for a lot of
Mm-hmm.
kids. We've set up where we, have the screen black and set up so that way it's not, as distracting.
Yeah.
But then you've also got, most families have multiple children. So then you've got other kids running around, or somebody
Yeah.
picks up the phone and now we can't see what's going on. And
Yeah.
so, there's so many new things to kind of navigate with utilizing a telehealth service,
Yes.
or utilizing telehealth to deliver our service. But, I think it's, at least we're able to give families like a little bit, at least we can kind of stay on track. Or if, some new behavior crops up, we can kind of guide parents on, okay, this is how you should respond to this based on what we've seen in the past.
Okay. Now, is this a time for parents that perhaps maybe if they've never had behavioral therapy at all, is this a good time to start or should it wait till they have contact with you? I'm just curious.
Yeah, I mean, it's never a bad time to start, I would say.
Hmm.
It's never, it's never too late. It's never too early. You want to, as
Good
much
point.
support you can get. Um, it probably wouldn't be our typical way of providing session. We probably would do some kind of telehealth to start, but we would really do whatever worked for your individual family and met your family's comfort level.
Got it.
For some of our families, depending on the skills of their child, who's our primary client, the telehealth might not work for them to receive direct therapy. So a lot of it then looks like just coaching parents. So, but
Yeah.
that's definitely something that can always be done via a telehealth service,
Oh, great.
because parents most of the time are going to be able to follow our instructions, even if their child really isn't able to. They can follow our instructions to hold their hand and help them to take a bite, or help them to brush their teeth, or whatever that might be. So it does, but it will then require a lot from parents. And I
Yeah.
think that's the piece, going back to your original question, is this the right time? It depends, kind of, I guess, depends on your work situation. If you're
Hmm.
like working from home, but you don't really have that much to do, given whatever industry you are in, maybe this is a great time because you're home and you've got a lot of extra hours to start working with your child. And we could set up like parent training to start, because you have more time in your day. So this would be a really ideal time.
Yeah.
But for other families who, if you're working from home, but you are really working from home, where you're on the computer all day long, to add something else to your plate, this probably isn't the right time to do that. So I think it
Right.
really is individualized to each family and their given situation. But we're not opposed to starting with new families at this time if anybody's looking for services.
Oh, good to know.
Um,
I liked how you said, like, one of the challenges parents have right now is the regression issue. How about on your end as the provider? What are the top challenges you're facing right now?
Yeah, I think as a provider, it's similar to parents. A lot of our staff have reached out that they are so conflicted with their ethical obligations to their clients and safety of their family.
Hmm.
We have some staff members who have their young children at home
Yeah.
or live with their parents who are elderly or have someone in their family with a compromised immune system that they are living with.
Yeah.
So
Yeah.
their feeling is, how do I can't go out and work and physically go see people, but I also have this ethical obligation. I want to help my families and help my clients.
Yeah.
So I think that's just been such a struggle for everyone in our field overall, just to try to balance those two things. So we've had to move some staff around on cases and to try and make it work. So we're trying to support everybody as much as we can in that regard.
And I totally see what you're saying because it's same thing in our profession too. We're able to do a lot of things online, doing video conferences like
Hmm.
this, but there are certain circumstances where we do have to meet the client. We do. That happened today. I just had to
Hmm.
help meet a client today, so that's why I'm wearing my gloves. I still have them on for whatever reason. And we kept the distance and we did what we have to do. And it's a decision, but it's difficult. It's challenging because, especially, with me too, I have older parents. They're in isolation at this point, but then for my younger child, her immune system is very low. So you're right, it's that
Right.
balancing act. And we do what we can do. That's it. We do what we
Yes.
could do.
Hmm.
Cara, do you have resources that you think could help parents that they should look into, besides contacting professionals like yourself, but other resources that could help support them that you might be able to recommend? Anything online, anything they can look up?
Yeah, so we actually just, in some ways, a little bit good timing, just launched our new website at
Oh,
the very
wonderful.
end of February. With we now have where we're going to be able to offer like webinars and recorded workshops for families. So one
Wonderful.
of the things that we have, the very first thing we put together, is our Purposeful Parenting series. It's a series of 7 videos, and the Purposeful Parenting is training that we do for families. Typically, we come into the home. It's an intensive 10-week parent coaching program
Oh,
where
wow.
we coach parents on the principles of behavior analysis. So, what we
Fantastic.
know as clinicians, how do we train you to know what we know so you can make all of those good judgment calls in the moment?
Great.
Because there's so many variables with every child. You in
Oh,
this
yeah.
situation you should do X, in that situation you should do Y. But giving you guys as parents the knowledge that we have, so that way you can make those in the moment decisions. So we put it together as a workshop series. So that's available on our website. And that's something that families can look into if that might be helpful. We
Great.
also, down the road when we can all meet in person again, we also do it as an in-person training.
Oh, that's great.
Our goal actually for next week is to put together a lot more of those types of trainings for parents.
Oh,
Um, One of the things we started talking briefly about before was consistency and then scheduling, like having a schedule. I'm not sure if you've done any activity schedules or you're familiar with that with your
right.
daughter,
Yes.
but that's
Okay.
something that we always recommend to families to do, is to do an activity schedule, teach your child to use an activity schedule. There's a lot of apps and different software that's out there now. So that's something else that we're going to be putting together. Hopefully should be available next week. Like, how do you start an activity schedule with your child? So that way you can help them to schedule their days. I
Oh,
actually
that's
do this
fantastic.
with my daughter as well. I'm going to see what the name of the app is so I can tell you.
Oh, yeah.
It's
That's great. And
Kids To-Do List, and it's
nice.
free. It's a free app. I'll show you what it looks like. I'll show you Catherine's schedule so you can see it. Um, but it is her she has like a getting ready for school schedule, so you
Oh,
can
that's
see it. She
great.
has to go to the bathroom, she eats breakfast, she
That's
gets
great.
dressed, and then during this time when she's not going to school, we put together a school schedule for her where we go over like the calendar, and then we go over letters and numbers, and we practice different things. And having that schedule there is as helpful to me as it is to her,
Oh,
because
that's great.
sometimes as a parent I'm like, I don't know, what are we going to do next? Here, I don't know, here's a coloring book. Here's this. And I feel like I'm just throwing things at her. But if we have a list, it does take more time for me. It takes time for you as the parent to do it ahead of time. But in the long run, it does make your day better and easier. And then it also helps your child to be more independent. Because if you can teach your child to follow that schedule, you're increasing their independence.
I love that, and it's funny because we do have a schedule, but it's nothing in an app. It's just me writing on we have a little whiteboard in our kitchen, and I schedule, say, okay, this is breakfast and this is snack time. She's big into snacks, Cara. So, and I know it's not great for a motivator, but, but we do
Gotta do
have,
what you gotta
time
do.
we're
No
going to do.
judgment here.
We have time that we're going out, and especially with me working at home, I was able to go to the office today, but for the most part, I'm at home. And so at least she'll know, okay, mommy has this segment where I have to do something. And then when I come out, this is what we're doing. And it makes the days much smoother. I mean, as much as she just can't wait, but at least she knows, okay, I'm anticipating that. So that is going to happen. And because it's on the board, that means it's going to happen, instead
Right.
of me just saying it, and she sometimes will, because I didn't write something on the board a couple of days ago, and she was reminding me certain things. She's like, we're doing this, I'm like, right, right, right. And I'm like, my bad. I didn't write it down. You're absolutely right, but that's a great app. Now, what's the website where people can find these resources that you were talking about, Cara? Do you
Yep,
have that? Oh, good.
I do. It's grahambehaviorservices.com. So that's our website. It's Graham spelled like a graham cracker. So Graham behaviorservices.com. And you
Excellent.
can find my contact information there. We have a contact us page if you fill that out. I usually will reach out to you directly within 24 hours. I contact our families to follow up, even if you just have questions about what our service looks like, accessing services, general questions. We're always available to help. We also do some advocacy services, once individuals are back in school, assisting with IEP needs,
Oh, great.
doing functional behavior assessments, those kinds of things as well.
I think we'll need to talk again and explore some of those other individual. The advocacy is that's a huge thing. I'd
Yes.
like to dwell on. Maybe we can schedule another talk about that as well,
Yeah,
Kara, because that is
absolutely.
a big issue.
Mhm.
And I mean, one of the things that we've been getting to in our office are questions about the IEPs. I mean, right now we're all home, so now we're
Right.
off. We're off
Yes.
the schedule, the program. Very challenging, very, very
Yes.
challenging. So I'd
And
love to dwell
huge
on that.
variability in terms of what districts are doing.
Yes.
Some are suspending IEP services and they're going to, you know, provide them later, but
Yeah, we
it's
just
important to
got
me.
for me, I just got a text from my daughter's speech therapist, and she said she was just approved to do things either via video or phone.
Mm,
Because I was curious, like, wow, I haven't heard anything for anyone in 2 weeks, and now,
right.
so that's good to know. I don't know
Yeah,
how that's gonna. I mean, we'll see how things work. But it's a start. I'm
it's
always
a start.
positive. It's a start.
Yeah.
Well,
Hmm.
Cara, I really appreciate your time. You were just
Yeah, of course.
fantastic. So again, for anyone to reach, it's grandbehavioral.com, and all your info's in there. Any phone
Yep.
numbers, everything, right?
Phone numbers there.
Awesome.
It's
Services.
grahambehaviorservices.com.
Got it. grandbehavioralservices.com. Cara, you're fantastic. We will be talking again.
Yes, I
And the
look
next
forward to it.
show hopefully will be live so we can have some interaction and have everyone come in with more questions. But if you do have questions, please send it to us. We'll be happy to answer them. And I'm sure Cara will be happy to connect with you and see what she can do to help you and your families. Cara, thank you again and be safe.
Thank you
And
so
we'll be
much. You
talking
too.
again. I appreciate everything. Thank
Look
you.
forward to it. Thanks.